In this video, I'm going to teach you the head-to-toe approach. This is a wonderful approach again. I usually use this approach whenever the symptoms are very vague, and I use with pediatrics OSCE scenarios. For example, if a patient has come with fever, or if the symptom is tiredness, or if the symptom is anxious or nervous, or if the patient has confusion. See, all these symptoms are a bit vague. This can be because of any problem anywhere in the body. It could be from an ear infection, it could be a bladder infection, it could be anything. So that's when I use this head-to-toe approach, where I start with head first. I usually look at if there is any problems with brain. For example, let's take tiredness. So I usually see if there are any causes in the brain that can cause tiredness. Then I'll go further down to eyes. Then I will go to ear, nose and throat. Then I will go to the chest, where I will look if there are any causes in the chest like lungs or heart causing this. Then I will go further down to liver and spleen. Then I will go further down to bladder. I will think about kidneys as well there. Then I'll go further down to genitalia, then further down to legs and skin at the end. So this is a very important approach. Anytime you're dealing with conditions like confusion, let's take confusion. If you go head-to-toe approach, it could be dementia, delirium in the brain. Then you go further down, it could be severe ear, nose and throat infection, or it could be a severe lung infection. It could be some liver problems, it could be some renal problems, it could be a UTI that is presenting as confusion, it could be a severe skin infection, it could be cellulitis of the leg, it could be any of these things. See there, once you're brainstorming using the head-to-toe approach, you will not miss any diagnosis. I hope this approach has helped. Make sure you use it for pediatrics and when you have vague symptoms.